Hey, this is Marty Stempniak, staff writer for Hospitals and Health Networks, reporting from the 17th Annual Not-for-Profit Healthcare Investors Conference in New York City, and I am joined today by Alan Levine, who is President and CEO of the Mountain States Health Alliance. Alan, thanks so much for being with me.
Well, thank you for having me.
Could you just start by telling our viewers a little about Mountain States and the markets it serves?
Yeah, we're the largest health and hospital system in Upper East Tennessee and Southwest Virginia. It's a largely rural area, 750,000 population that we serve, 14 hospitals, the region's only children's hospital. So we're a very, I think, important part of the community, and we're locally governed. We're a local community-based organization.
Mm-hmm. One of the issues you talked about in your session yesterday was the opioid epidemic. How severely has that impacted you and your market?
Well, of course, the United States leads the world in opioid use, and Tennessee ranks number 2 in the United States, and Upper East Tennessee, where we're located, ranks number 1 in Tennessee. And so it's a very big issue for us. Where you have economic stagnation or loss of hope, it lends itself to addiction. And our region has struggled economically with the unfortunate demise of the coal industry. And so it's really been an issue that we've had to contend with, and it's very challenging for families and for employers.
I understand that there's a merger in the works with you guys, and could you talk a little about that and how that is impacting the ways in which you're addressing this opioid epidemic?
Sure. Before I talk about the merger, I'll talk about the relationship we have with East Tennessee State University first. The Board of Regents in Tennessee recently approved East Tennessee State University starting a Center for Prescription Drug Abuse and Treatment, and we're partnered with ETSU. In fact, we recently just announced our plans to develop a clinic, which would be part of the treatment process for people that have opioid addiction. So that's one piece of this component. Unlike most of these types of clinics, ours will be not-for-profit, and the profits from the clinic will be used to invest in research, which nobody else really does right now. And I think our model's different because we want to try to really focus on what are the root causes and how do we actually help families get in front of it. Longer term, our merger with Wellmont Health System, which is our another health system based in our region, a great system. We have a great relationship with them. Part of the merger is, and as a locally governed enterprise, we want to solve local problems, and obviously top of that list is addiction. So our plan, and as we've committed to the state of Tennessee and the Commonwealth of Virginia, is actually to develop a regional residential addiction treatment campus that would really help people get a new start in their lives through residential addiction treatment, and as part of the larger package of treatment of options that are available. So I think the merger lends itself to helping to solve these problems locally. If we don't do it, nobody else will.
Mm-hmm. Just in closing, Alan, is it kind of music to your ears to see this conversation about this epidemic finally, get a little louder and take a nationwide angle?
I'm glad there's a national dialogue about it, and we can focus on treatment and prevention. This has been a problem a long time in the making, and there's all types of causes, whether it's overprescription for legitimate pain or abuse. Or illicit sales. I mean, there's all kinds of reasons why addictions happen. So I'm glad there's a national dialogue to at least begin to understand the root causes so we can actually try to prevent it. And I am encouraged by that. And as a health systems all over the country and employers all over the country are having to deal with this in the trenches where it matters. And whatever Congress or the President or Congress and the President decide to do, I hope they remember the people that are out in the front lines having to try to deal with this. It's not just a political issue. It's an issue we live with every day.
Great. Alan, thanks so much for being with me today.
Sure. Thanks for having me.
For HNHN, this has been Marty Stempniak. Thanks for watching.